Hello, I'm going to be demonstrating my clinical skill of traction. This is my patient. The first thing I'm going to do is compare my provider's orders against the MAR, wash my hands, I would apply gloves. I'm going to identify my patient with 2 patient identifiers. I'm going to introduce myself and I'm going to explain traction to my patient. Traction is the pulling of bones using certain devices such as rope and weight to pull the bone back into place. We're going to be doing bucks today with a 5-pound weight. The purpose is to prevent muscle spasms, pain, deformities, and to make sure the bone just goes back into place. So the 2 most common are skin and skeletal, and the 2 most common for spasms is bucks, which is for the hip/limb, and the other one is going to be central, which can prevent muscle spasms in the neck. So the first thing I'm going to do is assess my patient. We want to check for oral temperature as well as the temperature of their limb. We want to make sure there's no infection. If there is, we're going to have to contact an HCP. We want to check their capillary refill, their pulses, their peripheral pulses, the pedal and the distal. Once that's all set, we're going to assess the traction device. Want to make sure the ropes are not loose or frayed. Want to make sure the patient is aligned. If they're not, the bone could be pulling the wrong way. Want to make sure the trapeze is connected properly as well. We want to make sure the weight is the same. Now, we also want to assess for their fluids, make sure they're getting enough because they're laying in bed for a long time. We don't want them to get dehydrated. We want to prevent constipation. The next thing I'm going to do is ask if the patient is in pain, if they're having any muscle spasms. If they are, we can adjust the weight. If they're still having it, we're going to have to contact the HCP. We're also going to make sure that we want to prevent compartment syndrome. So we're going to check for paralysis, make sure there's feeling in the foot, check the pallor, because if anything like that is going wrong and they can't feel it, then there's going to be further complications. Now, I'm just going to make sure that the patient doesn't have any more questions, and after that, everything should be good to go. I'm going to make sure their belongings are in reach, the call light's in reach, they're comfortable. Take off my gloves, wash my hands. I'm going to document all the care that was provided, the weight, the patient's responses and outcomes. Then my patient should be good to go.